Hi, my name is Lauren Penton Simpson, and I am enrolled in the Graduate School of Nursing at Southeastern Louisiana University in the Family Nurse Practitioner program. And today I would like to talk about COPD self-management and proper inhaler technique. So first, let's start with what is COPD. COPD is chronic obstructive pulmonary disease. It is considered a long-term lung condition. It causes airflow restrictions and difficulties breathing. Common symptoms you'll see with COPD are shortness of breath, also known as dyspnea, cough, and sputum production. Other symptoms include wheezing, chest tightness, fatigue, and activity limitations. COPD is a progressive disease, but is manageable with the proper treatment. Self-management is extremely important for patients living with COPD. Not only does it reduce the risk of flare-ups, but it improves daily functioning and energy. Proper inhaler use with the self-management, it helps medications work more effectively. And also these techniques empower patients to recognize early warning signs of exacerbations. In this slide, we'll discuss some of the COPD self-management strategies. The first topic is medication adherence and proper inhaler technique. This includes taking maintenance medications daily and then also following through with rescue inhalers as needed. Most patients will have a COPD action plan that outlines exactly how they should be taking their daily and their as needed inhalers. Another part of self-management is increasing daily activity or maintaining daily activity. Some of the examples of moderate activity can just be brisk walking, cycling, whatever type of aerobic activity that keeps you active. It is important to use pacing strategies, especially whenever you start getting short of breath. It's important to pace yourself, take breaks when needed, and to recognize whenever you need to break your activity. The next topic is about breathing exercises. Breathing exercises are extremely important to practice for whenever you actually need to utilize them when you get short of breath. Two examples listed here are pursed lip breathing. Pursed lip breathing is where you inhale strictly through your nose and exhale through pursed lips. It's kind of like smelling the roses and then blowing out the candles. Diaphragmatic breathing is another type of breathing. It's also called belly breathing. You can use that in a combination with a combination of the pursed lip breathing. Diaphragmatic breathing is where whenever you take an inhale, you're actually going to puff your stomach out. And I have some videos included here to give you some examples, and that actually demonstrates pursed lip breathing and diaphragmatic breathing. Other self-management strategies include symptom monitoring. This is where you track your coughing, the amount of sputum or the amount of phlegm that you're producing, and shortness of breath. These can help you to recognize when you're having an early exacerbation, say you're having increased coughing with an excess amount of sputum, so you're making more sputum than you normally would, as well as changes in the sputum color are all important things to pick up on. Other self-management strategies include avoiding triggers such as smoke, dust, allergens, and people with respiratory infections. Some of these examples, I know you may not be able to get away from all of them as far as with the dust and the allergens, but frequent hand washing, wearing masks when appropriate are all important self-management strategies. The proper inhaler technique that we're going to be discussing today is the Trelegy Ellipta DPI, which means dry powder inhaler. This is just a brief overview. So the Trelegy Ellipta is a dry powdered inhaler that delivers 3 medications in one puff. It's to be used daily for maintenance therapy, so this is not for rescue use. It helps to open the airways and reduce airway inflammation, and it works best when used correctly, which that makes sense because if you have proper technique with the inhaler use, then you're going to actually get all of the medication that needs to be delivered. On this slide, we're going to cover step-by-step dry powdered inhaler technique. You can see listed here, I have listed each of the 7 steps of the proper inhaler use. And then at the bottom, I have a demonstration video that was put together by the American Lung Association. So first we're going to cover the steps and then we're going to pause for a moment to be able to watch this video. So the first step of the proper inhaler technique is to open the cover of the inhaler until it clicks. That's going to activate the medication. The next step is to exhale fully away from the mouthpiece. Then you will close your lips tightly around the mouthpiece to form a good seal. Once you have a good seal, you will inhale quickly and deeply in one breath. Hold that breath for approximately 5 to 10 seconds, and then you will exhale slowly away from the inhaler. And then, of course, after using the inhaler, we want to ensure to rinse our mouth, and that is because there is a steroid in medication in that inhaler, and so we want to decrease the chance of thrush. So we're going to pause here to take a moment to watch our demonstration video and practice proper technique. Okay, now that we've been able to watch the video and had a little time to practice, let's cover some tips that will help you to improve your inhaler use. First, always check the dose counter before using to ensure that there is a dose of the medication left in the inhaler. You would want to practice in front of a mirror, especially if you feel like you're unsure of your technique. Always keep your inhaler clean and dry. And until you feel confident, you just keep repeating this demonstration, watching in the mirror, rewatching the video until you feel confident in your proper use. Another important part of self-management is recognizing exacerbations. And we spoke a little bit about this earlier, but I thought it was important to hit on this again. Some of the signs of an exacerbation would be increased shortness of breath. So if you notice that you're more short of breath with your daily activities, doing the dishes, walking from the chair to the bathroom, those are all early signs that something's going on because you're more short of breath than usual. Another important sign to pick up on would be changes in sputum color or amount. So if you're producing a lot more sputum than usual, the color has changed from clear to yellow or green. That's all very, very important signs to pick up on. Other symptoms that you may experience would be a fever, wheezing, or chest tightness. And at this point, when you start recognizing any of these symptoms, it's very important to contact your healthcare provider, your primary care physician, your nurse practitioner, whoever is overseeing your care so that you can receive adequate management.